I'm Dr. Martin Rutherford, chiropractor, certified functional medicine practitioner. Today we're going to talk about one of our favorite subjects, fibromyalgia, and one of its most prominent aspects, which is fatigue.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
In fact, back in the 90s when people started showing up in my office when I was doing pretty strictly musculoskeletal issues, they started showing up with CFIDs.
Mm-hmm.
And we are in Reno, Nevada, at the foothills, of the famous Sierras, which are covered with snow this morning. And about 35 minutes from here, up in those Sierras, in Incline Village, Nevada, better known today as Income Village, Nevada, where the billionaires have replaced the millionaires. That is where the theory of Epstein-Barr virus was developed by a doctor that I happen to know and have skied with a few times over the years. And so we started seeing this chronic fatigue syndrome. And at that time, I kind of didn't get but you can't touch me. I'm thinking like, well, you're fatigued. Why can't I touch you, you know? And so it was not known at that time. In fact, fibromyalgia means pain in the muscle fibers. And so pain in the muscle fibers is wrong. It is a neurological pain, which the people who are advertising Lyrica are actually starting to acknowledge. I saw that on television the other day. So fibromyalgia, fatigue. So the whole point is they're like this. Fibromyalgia and fatigue are like this. If you can have fatigue without having fibromyalgia, but if you have fibromyalgia, you're going to have fatigue. And here to tell you why, because we're going to keep this efficient today, but I'm not going to tell you why, is what's your name again? Dr. Randall Gates. But no, seriously, pretty much if somebody walks into me and they just say fatigue, and I'm doing one of my initial consults to try to screen that person, I'm going to say, well, here's what we think about fatigue: thyroid, blood sugar, stress hormones, gut, Epstein-Barr virus, and possibly anemia. And Epstein-Barr virus most of the time causes thyroid problems, which cause fatigue. That's like my initial opening. So when we think of fatigue, we think of somewhere in there. Dr. Gates is going to get into this in much more detail, and he's going to add a little bit of a snippet relative to how much the brain is involved, and the fact that one of the reasons that I think we're getting the successes that we get here is we have, over the last couple of years, really shifted to emphasize getting brain function stabilized in pretty much most chronic conditions, particularly chronic pain conditions. And it has really made a change, and it's really made a shift in our results. And so he's going to share a lot of that with you. So since we have a time element here today, I'm just going to listen. Unless you say things that I don't understand, because then I'll have to translate them to them.
Got it. So Dr. Rutherford outlined the list of the numerous causes of chronic fatigue for the fibromyalgia and the chronic fatigue sufferer, starting with the gastrointestinal tract. That's an area of extreme importance for fibromyalgia patients for a number of reasons. The first being absorption of pieces of bacteria into the bloodstream. That's called subclinical endotoxemia. It's a fancy term. Just know that, think of it, this is the analogy that we commonly use: dandelion flowers blowing in the breeze. So with that analogy, the dandelion flower is like the pieces of bacteria, and as they blow off, then they go into your bloodstream. And when that happens, that initiates a lot of inflammatory immune mechanisms that in and of themselves can be associated with fatigue. We also know that a huge proportion of fibromyalgia patients have food intolerances. Probably most of you have heard of this, the gluten fibromyalgia connection. Now, that is not necessarily the whole puzzle. Most typically, it's not the whole puzzle, but that can be a piece of the puzzle. And we found gluten to be the tip of the iceberg, really. So many people now are going gluten-free, and they're eating foods that we're finding to be just as inflammatory as the gluten was. So it's a very confusing, muddled issue, especially
the gluten-free products in the package.
Exactly, and especially when then you consider that a lot of fibromyalgia patients have irritable bowel syndrome. And when an individual has irritable bowel syndrome, they have different bacteria in their intestines than someone who does not have irritable bowel syndrome. And
one step back real quick. When fibromyalgia patients come in here, when fatigue patients come in here, it's thyroid, blood sugar, adrenals, gut, mitochondria, or viruses, and anemia. When a fibromyalgia patient comes in here, here's what we see consistently. Hashimoto's thyroiditis, a bad gut, could be any of the things that he's talking about, usually an autoimmune involvement, and then the super sensitivity of the skin. So those are our 4 things that Dr. Gates is going to allude to consistently throughout the rest of this 20 minutes.
So then with these food intolerances and the IBS connection, when people have IBS, they have different bacteria in their intestines than those who don't. And lots of times when they go on a seemingly healthy diet, let's say they go on the paleo diet, they frequently react to a lot of the vegetables that are in the paleo diet. So then you may feel worse.
So I laugh because Paige comes in and I'm interviewing them and they go, but I'm on a vegetable diet and I'm bloating and I got gas and that's this.
Yeah, or they're eating gluten-free and they're feeling worse.
I mean, they're eating better than 99% of the human race,
right?
But it's killing their gut.
Exactly. And then perpetuating their fatigue. So that's how complicated this can be. So you have to find the right diet for the right person. You have to use protocols to get rid of these bad bacteria. We found that to be essential, and it is more complicated than just using probiotics. So that's step number 1 as it pertains to the gut and fatigue. And we've had patients with fibromyalgia and fatigue, and they come in here and we find the right diet, we correct their gut bacteria, and their fatigue goes away. We've worked with a lot of fibromyalgia patients where that wasn't the case, where we did all that and they're wanting to feel better in 4 to 6 weeks and they're not better because these are complicated vicious cycles that are involved with the fibromyalgia patient.
Multiple vicious cycles.
Exactly. So then the other thing you have to consider when there is this gastrointestinal dysfunction that we just illuminated via pieces of bacteria, food intolerances, what the literature is finding is that it can skew the immune system. So the immune system becomes overactivated to the GI tract. And when that happens, that can allow the immune system, for some genetically predisposed individuals, to not see recurrent exacerbations of chronic viral infections. So that's the whole Epstein-Barr virus link that they're seeing. So a lot of you know about Epstein-Barr, and people out there are telling you that's the main thing. You're reading the medical medium books and they're telling you, you know, all this stuff is Epstein-Barr. And while Epstein-Barr is completely involved, it is not the whole enchilada, so to speak. And you have to ask, why is Epstein-Barr so prevalent? So that's the first step.
We need to do a talk on that. Epstein-Barr. Just Epstein-Barr. Like, because it hits, because then it hits the thyroid and then it creates immune responses and then it becomes very confusing.
Yeah, absolutely. So then the Epstein-Barr virus starts to have a party. Just so you know, the Epstein-Barr virus is a virus that all of us have been exposed to, at least 95% of the population, basically by the time you're 30 years of age. You may have had mononucleosis, most likely you didn't. Most likely you got exposed to it in childhood and you either had the symptoms of a cold or you had absolutely no symptoms from it. But later in life, when we illustrate this mechanism, then the virus can start to have a party for all intents and purposes. Think of the virus at Club Med, because your immune system is here and it's not keeping that virus pushed down. So then that virus can start to live in your thyroid. And so there's a huge association between fibromyalgia and autoimmune thyroid disease called Hashimoto's thyroiditis. And that immune inflammation to the thyroid gland also in and of itself can be a cause of fatigue. So your thyroid tests may be normal, and your thyroid tests are basically a hormone that comes from your brain telling your thyroid to work, or 1 or 2 tests regarding thyroid hormone production. But frequently, I would say 95% of the time when patients come in and tell us that their thyroid tests are normal, they haven't had the immune counts to the thyroid run. And lots of times these immune cells to the thyroid form because, again, Epstein-Barr virus is starting to live in the thyroid. So once you have this amount of immune dysfunction, then your immune system tries to become overreactive to the virus, now that it's having a party, and it's like playing whack-a-mole. So one side of your immune system gets overreactive to the virus, and the other side is still not seeing it because of the gastrointestinal dysfunction, low vitamin D levels, which involves immune regulation. So we have that. And then we have to consider that the Epstein-Barr virus and these other chronic viruses can cause damage to your energy producing factories in the cells of your body. It's termed the mitochondria. So the mitochondria, think of them as being a dam. And in order for the power company to generate electricity from a dam, you have to have a solid border, so then they can release some water and the turbines basically move, and that generates electricity. The mitochondria are a very similar concept in how they make energy, but these viruses can damage the wall of the mitochondria, like damaging the wall of a dam. So when that happens, then you can't make energy and you can be fatigued. Now, the other major component to fibromyalgia is stress. A huge proportion of fibromyalgia patients have been exposed to trauma in childhood, sadly. And with that trauma, then that can initiate activation of the fear response in the brain to where it's too overreactive, and that can stay that way basically for the rest of their life. Or maybe there wasn't childhood trauma,
So
but you're going through a divorce.
Say stress hormones.
Okay, fair enough.
So stress hormones, because he's talking about emotional trauma that sets off a part of your amygdala. And the functional neurologists even have started to call it sympathetic windup. Mm-hmm. So basically puts you in fight flight syndrome all the time. Sometimes like this, sometimes like that, but all the time, the stress hormones are continually going out. Some of the signs are you'll get anxiety for no reason at all, or maybe you can't go to sleep, you wake up, you can't go back to sleep. And the reason I interrupted is because this isn't always you being stressed, or it isn't, because that's what people think when you say stress. And then they get defensive, like, I'm not stressed, no, I can handle stress, and all that type of stuff. This isn't that. This is you sitting there going, why am I feeling stressed? Why am I feeling a panic attack? Why am I feeling anxiety? There's nothing to be stressed about. There's no anxiety. And then you can't overcome it. So it's really the stress hormones that are coming out from the emotional trauma that Dr. Gates just got done telling you turns your brain on. Now, I apologize, but that when I'm doing the consults, that seems to be kind of a reaction. If I say stress, people kind of go like, and I go, no, that's not what I mean.
And with these stress hormones being too high, this can be part and parcel to the physiology of depression, to the physiology of anxiety. These are comorbid conditions, associated with fibromyalgia, and they can cause fatigue by themselves. So most of you know, if you go to your general practitioner or your primary care practitioner with a complaint of fatigue, many of you have been diagnosed with depression, and you may be telling your doctor, no, I'm not depressed, I'm fatigued. And your doctor is saying, well, according to the classification criteria of major depressive disorder, generalized anxiety disorder, you do have these conditions because you're not sleeping, maybe you're putting on weight, or you're losing weight, you're not feeling so good, so that's called dysphoria. You're losing pleasure with your hobbies because you're in pain all the time. That's your argument, but your doctor's like, hey, you're not engaging in hobbies, and you're fatigued. So you have depression. That's the classification of it. We've done broadcasts basically showing you the dichotomy of those two things. So we don't need to get into that in great detail, but you need to understand that your brain and these stress hormones can cause and be associated with fatigue. Then there's the component of functional adrenal fatigue, which is not acknowledged medically from a diagnostic perspective, though there's tons and tons and tons of research demonstrating its efficacy. So we work with functional adrenal fatigue, and we see changes when that piece is very involved for improving fatigue for fibromyalgia patients. And then there's a component of when you've been under these stressful conditions or you've been exposed to trauma for so long that ultimately your whole stress system actually burns out. And so then it's called a low HPA axis. Basically, the P is your pituitary and the A is your adrenal gland. So basically that function becomes low. So rather than tons of stress hormones, you don't have hardly any stress hormones. Either you burned out your adrenals or your brain is just turned off now. And now you're the individual who sleeps 10 hours and you still wake up feeling fatigued. And that is a brain neurochemistry problem that we have found to be the case. And you actually have to get the whole stress cycle recovered. You have to heal the adrenals, and then you have to get the stress circuits actually firing higher again, which seems almost opposite of or paradoxical of what you'd want to do, but that's actually what we found you have to do to get those patients feeling better again.
Everything he's mentioned alters brain chemistry. Thyroid, we didn't mention blood sugar yet. Blood sugar, your brain needs proper blood sugar. You don't get enough blood sugar, you get irritable, shaky, you want to kill somebody, you get too much blood sugar, you fall asleep. Adrenal, stress hormones, gut, mitochondria, talked about the factories. I used to use the term factories when I used to do my talks. And anemias. All those things decrease oxygen, alter blood sugar, cause inflammation in the brain.
Absolutely.
So you have to fix all those.
Yeah, fix all those. And let's just touch on the anemias one last little bit. So with the anemias, you may have low iron. Maybe you have really heavy menses. If you have anemias, you got to make sure there's not a gastrointestinal bleed. Or maybe you have anemia because you have H. pylori, which is a bacteria that lives in the stomach, especially when people have been under stress for long periods of time. or they have a low thyroid. And so that allows that bacteria to live in your stomach, and through a series of chemical processes, it doesn't allow iron to really be absorbed into circulation. So that can cause anemia. Or maybe, as commonly as the case associated with Hashimoto's, your immune system actually might be killing your stomach, not allowing you to absorb proper levels of B12. So hopefully from this, even if you want to take a big board and trace out exactly what we just said, you can see there's this complicated web of physiologic dysfunction. That doesn't mean that you're destined to chronically suffer with fatigue in our experience. If you can go through and correct this in basically a systematized fashion, handling the big pieces first, that's where we've had pretty good results with fatigue in the fibromyalgia patient population. There are other associated causes that you have to rule out. I mean, you got to make sure somebody doesn't have a cardiac condition. You got to make sure they don't have sleep apnea. You got to make sure you look at, do they have POTS? That's a type of tachycardia syndrome that can develop, that we see often with fibromyalgia patients. Just saw one last week. So,
and that's a great point, because one of the things that we found when we started delving into this years ago was we could not be, oh, all alternative is good and all medicine is bad. In fact, when Dr. Gates ultimately writes the impressions on the reports that we do and I go over with the patients, he always provides a section on the classic medical diagnoses, because you want to know if there's pathology there. The patient that walks into this office and tells me, I'm no drugs ever, ever, ever. Well, that's fine. We have kind of a bell curve here, and this many people fit into the no drugs part, but these don't. Because if you have these issues, they have to be taken care of. You have to be realistic about what they are. But you have to be able to determine what is the number one aspect of that particular person's fatigue. And the reality is if you take all of those, for those of you who have some math background, if you took all of those possibilities and say there's 12 of them, how you do it is you multiply 12 times 12 times 12 times 12 times 12 times 12. That's the number of possibilities of combinations that you could have coming in here with a fibromyalgia patient. And so you have to have a history that is condition appropriate. Fibromyalgia, in our particular case, it's chronic pain history, which envelops fibromyalgia. You have to have an exam that is reflective of your patient population. In addition to that, and frankly, by the time you get done with those two things, most of the time you should know which elements are there for that patient and which one is the most important. And you may need to do some more testing at that point, even to verify some things, especially if pathologies are considered to potentially be involved. So we refer, Dr. Gates refers to all kinds of doctors. We do MRIs. We refer for MRIs and CAT scans and SCMGs and NCBs. But you need a full understanding of what is going on with the patient before you execute in something as complex and, as Dr. Gates's favorite term is, as nuanced as something as this. Then you can order tests. Most of the time for us, those tests are going to give us the data we need as to how to attack what's been found in that history and exam. But sometimes we need tests to rule out pathology. Sometimes we need further tests that are maybe considered specialty tests to maybe be more refined about that case than the next case. But that is I want to draw it in practical terms when Dr. Gates talks about the metabolic physiological complex web of chronic pain, which is a mouthful. That's what he's talking about in practical terms. And then you have to negotiate the patient through that minefield one at a time, all right? And understand how to do that. So fatigue is more than you have Epstein-Barr virus, let's take an antiviral, you know, or take any one of them. Oh, you have anemia, let's give you iron. But I'm taking iron and I feel terrible. There's a reason for that. It's because there's another reason why you're deficient in your anemia and so on and so forth. So it's a complex, it is complex, but it is doable. And that's what Dr. Gates is saying, well, you can put all these on the board and you could try, and that's why you're probably watching this. And this is the problem with the internet, is the internet presents it simplistically, who's selling their product, who's got their, I just read something yesterday on, oh my goodness gracious. Oh, on milk allergies. I just read this whole thing. I mean, they would have you living in a cocoon by the time you got done with doing what they're saying. And so they have this presentation online for the most severe. The person who walks in a room and there's a glass of milk sitting there and they're like, breathe it in and they get allergic, you know? I mean, you know what I'm saying? So, so anyway, so it's complex, but there is a way to do it. And that's what Dr. Gates was trying to warn you about a little bit, and saying like, okay, you can take all these things, but if you take them all and you do them one at a time, you don't get better. Don't say, oh, you guys don't know what you're talking about, because that's what he was articulating to you. We still got a lot of time.
Well, I think
but I'm
pretty
done.
well hit it. We summarize in a succinct fashion. Okay. Yeah. Very good. So we hope you enjoyed this, and we'll be back next week with another topic. We've appreciated the suggestions we're getting from those on Facebook and YouTube in terms of other topic ideas. You can go to powerhealthtalk.com to access this broadcast with all the reference research articles attached. You can also go to our other chronic fatigue broadcasts. I drew on some of them for today's broadcast as well. And I think that pretty well says it. So thanks for watching, and we'll see you soon.